This is TTT Live. I'm DK Roster. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. This is the Ministry of Health's virtual media conference on the national COVID-19 response. Here in studio with me are Dr. Miriam Abdul-Richards, Principal Medical Officer of Health Institutions, and Dr. Avery Hines, Technical Director of Epidemiology at the Ministry of Health. And today we focus on Tobago. And so joining us virtually are Dr. Tiffany Hoyt, County Medical Officer of Health for Tobago, and Dr. Roxanne Mitchell, General Manager, Primary Care Services for the Tobago Regional Health Authority. I'm Candice Alcantara, Manager Corporate Communication at the Ministry, and I will moderate this morning's media conference. We go straight to Dr. Richards, who will present today's clinical update.
Thank you ever so much, Ms. Alcantara. Dr. Hines, my esteemed colleague, and welcome to our colleagues from Tobago, Drs. Hoyt and Dr. Mitchell. Good morning to all members of the media. Thank you again for your consistent attendance at these media conferences as you continue to provide transparent and up-to-date information to the population. Good morning, Trinidad and Tobago. This morning, I will provide a status update on the parallel healthcare system, as well as an update on the ongoing repatriation exercises that are being led by the Ministry of Health and the Ministry of National Security. As per media release number 665, dated Tuesday, 16th of March, 2021, and as of 4 p.m. yesterday, I'd like to provide a brief summary of the statistics in the parallel healthcare system. As of yesterday afternoon, we had 103,422 COVID-19 tests that have been done in the public and private sector. Of these, 7,790 persons have tested positive. Over the last 48 hours, there have been 2 confirmed cases of COVID-19, taking the active number of cases at present to 106. These 106 cases are further distributed as follows: 98 persons in home isolation, 5 persons in the parallel healthcare system hospitals, that is specifically only at the Couva Medical and Multi-Training Facility, and 1 person at the J-Base Step-Down Facility. Our hospital occupancy rates have been under 5% over the last month and actually are at an all-time low now of 2%. These have been the lowest hospital occupancy rates since the May 1st, 2020. Additionally, our ICU and HDU occupancies are currently at 0% and have been at this level for the past 10 days. Thus far, we have had 140 deaths, and again, we would like to express sincere condolences to the relatives, families, and friends of these persons. At present, and as of 8 a.m. this morning, there are 312 persons who are in state or state-supervised quarantine facilities. And again, we would like to thank the members of the population and their families for their patience and support in the repatriation exercises that have been ongoing since April of last year. I'd like to just provide a brief summary on the last repatriation exercise that was carried out, as well as the next 3 repatriation exercises that are scheduled between March 18th and March 31st. Our last repatriation exercise was carried out on March 13th, and we had the return of 121 nationals who came via Barbados. It is imperative to note that persons who come from the United Kingdom via Barbados have to spend a 14-day quarantine either at state or state-supervised facilities to reduce the risk of transmission of the UK variant. This has been part of our national policy as a method of reducing risk, of course, and preventing the transmission of that UK variant. We have another repatriation exercise that's scheduled for tomorrow, and that's New York City, approximately 120 to 130 returning nationals. Another exercise is scheduled for March 24th from Guyana, as well as one from Barbados on March 27th and Miami on March 31st. I'd like to reiterate to the population that the Ministry of Health and Ministry of National Security priority would be to bring back as many returning nationals, but in a safe and controlled manner to reduce the risk of COVID-19. Thus far, all repatriation exercises that have been carried out have been successful in that no person has been turned away with respect to their admission and entry into Trinidad and Tobago and at a state or state supervised facility. In closing, I would like to remind the population to continue exercising personal responsibility with respect to the COVID-19 mitigation measures. Don't be fooled by our low occupancy rates or our small gains. Continue with the 3 W's. Continue to wear your mask, continue to watch your distance, and continue to wash your hands. Thank you very much, Candice.
Thank you very much, Dr. Richards. And we go to Dr. Hines for a brief statement from him at this time.
Thank you, Ms. Alcantara. Good morning to Dr. Abdul Richards. Good morning to Drs. Hoyt and Mitchell. Good morning to members of the media and members of the viewing and listening public. My intervention this morning will be quite brief, and it is really to continue on from the last statement made by Dr. Richards. We are looking at this point in time at the distribution of the active cases that had just been described being 98 overall, with more than 52 of them actually in one county. And we really do want to emphasize the importance of continued adherence to the guidelines, to the behaviors, to the risk reduction strategies that we have been advocating for the last year and change. We are basically in a situation where our behavior patterns, the things that we do, the risk reduction, is what is driving the relatively low numbers, the relatively low occupancy, the relatively small numbers of cases from day to day. But small changes in behavior can have changes in that equilibrium, that balance between behavior and cases. So what we see right now is that whereas a week or two ago we would have had a rolling 7-day average of 3 cases per day, we're now at 8 cases per day, just as a result of some of the cluster activity that we've noted in County Caroni in particular. And just to demonstrate the rapid potential for spread or the rapid reach that any one case can have in the cluster investigations that have been carried out so far, we note that one individual, one confirmed case, actually spawned as many as 34 contacts that then needed to be followed up. And those contacts would have the quarantine and testing activities being carried out to verify whether they're infected, and to ensure that if they are, they don't pass that infection on to other persons. But you can see the scale at which this infection can bloom or blossom or surge again if we aren't careful. So while we generally want to congratulate the population on the maintenance of the behaviors, we do want to remind those who are getting fatigued, those who are relapsing into the less careful behaviors, that this is not the time for that. We still need to hold the fort and continue the behaviors that have been keeping our numbers as low as they have thus far. So that's my brief intervention. I'm going to turn it back over to Ms. Alcantara.
Thank you, Dr. Hines, for that very important reminder. And those of you who watch the program continuously know that we continue from our end to emphasize the need for all of us to do our part. We have come a long way, but if we continue doing what we have been doing, we will see the end of this and come out successfully. We go now to a presentation from Dr. Hoyt. As the County Medical Officer of Health for Tobago, she's well poised to give the Tobago perspective on the management of COVID-19 in the Sister Isle. We go to Dr. Hoyt.
Hi, good morning everyone. Thank you, Ms. Alcantara. Good morning to yourself. Good morning to my colleagues, Dr. Richards, Dr. Hines, and Dr. Mitchell. And good morning to the media and the members of the viewing public. So 1 year into the outbreak of COVID-19 in Trinidad and Tobago, I would like to share the statistics for us in Tobago and some of our experience throughout the outbreak thus far in Tobago. Can I have the first slide, please? Okay, so, second slide. Back. So we've had, currently, as of 10 p.m. yesterday, we have had no new cases reported, and we currently have no active cases on the island. So from the time we confirmed our first case last year, which would have been on the 21st of March, up to our most recent cases, we've had a total of 159 confirmed cases of COVID-19 in Tobago. Next slide. So this slide demonstrates the number of cases that we have had on a daily basis. Now, I would have mentioned that our first case was actually in March of last year, but from the period of March and April of 2020, we had a total of 5 cases. Then, from the month of August 2020, we had a huge surge in cases, which is when Trinidad and Tobago began to experience our second wave. So this graph shows from August of 2020 to March of this year. You would note that our largest number of positive cases in a day would have been 12 cases, which resulted from the outbreak at the Tobago prison. If you look at the graph, you'll see there are flat areas because we had periods where we would have had no recorded cases for duration. So there was a 26-day period from the 28th of October to the 24th of November where we had no recorded cases. And similarly, for most recently, we had a 30-day period where we had no recorded cases from the 28th of January until our most recent cases. And I highlight just to emphasize to members of the public that even though there may be no recorded cases currently in Tobago and in some of the counties, we cannot afford to become complacent because COVID-19 is very much still present in our communities. And to control the spread of the virus, we urge persons to please remember to continue practicing the 3 W's. Next slide. Next slide. Yeah, next slide, please. Skip. So this graph shows the cases in each given month. And just to highlight certain things in the graph, our first 5 cases, as I mentioned, would have been in March and April, followed by no cases in the months of May, June, and July in 2020. Then when we had the upsurge of cases in August, that's where we had our most number of cases recorded overall, with 27.7% of all our cases being recorded in the month of August last year. And this coincided with when there would have been a rollback on restrictions as well as pre-election campaigning. The month with our second greatest number of cases, which would have been October of 2020, correlates with when we had the outbreak of COVID-19 at the Tobago prison. Next slide. So this just shows the distribution of the total cases that we've had between males and females. We noticed that the proportion of males was only slightly higher at 51% compared to 49% of our cases being females. Next slide. So this demonstrates the age and sex distribution among all the confirmed COVID-19 cases in Tobago. The vertical bar graph shows the age distribution, and it demonstrates that the majority of our cases were in the 30 to 39 age range. Our youngest confirmed case, as persons will recall, would have been a 5-month-old, and our oldest confirmed case would have been an 84-year-old. Now, 16% of our cases were less than 18 years old, but thankfully we've had no cases of MIS-C among our pediatric population in Tobago. And when we look at the proportion of females to males in each age category, the percentage of females actually was greater than the percentage of males, except in the over 60 and especially within the 40 to 49 age group. Next slide. So among the 159 confirmed cases in Tobago, 26% of our cases had comorbidities. And of these 26%, the most common chronic diseases were hypertension, followed by asthma, followed by diabetes. Next slide. Of note, 30% of the confirmed cases in Tobago had no symptoms. And this includes the most recent 4 cases that we recorded. In fact, from the most recent cases, 2 of the cases were detected by persons who were being screened for elective surgery. And then in testing all their primary and secondary contacts, the 2 contacts who would have tested positive also had no symptoms. So I just highlight this in order to remind persons that persons may not have symptoms but can be infected with COVID-19 and can spread the virus. So again, the importance of wearing your mask properly and social distancing and avoiding large gatherings. Next slide. So this slide lists the frequency of symptoms amongst our confirmed cases who did present with symptoms. The most common symptoms being fever, cough, and muscle pain. Next slide. So this slide shows the geographic distribution of our confirmed cases throughout the island. The location of the majority of the cases on the southwest part of the island coincides with where we have the greatest population density for Tobago. That's it. So in closing, I just want to also share with members of the public that our Tobago Tourism Agency Limited, we constantly in collaboration with our tourism stakeholders, and they have indicated that we have an expected occupancy for the upcoming Easter period of 98% of our villas, 76% for apartments, and 67% for the hotels. Well, that's all things being equal with respect to transport over the air and sea bridge. But we know and we expect that persons will be vacationing in Tobago for the Easter, and we definitely welcome everyone. But we also would like to take this opportunity to remind everyone, COVID-19 still remains an active threat to the health and the well-being of the citizens of Trinidad and Tobago. The public health measures and the COVID-19 protocols are there for the benefit of everyone, to protect everyone. So let us continue to work together and adhere to the protocols in order to minimize exposure to the COVID-19 virus. So again, we remind persons when you're entering facilities, please don't bypass the hand washing stations. Remember, part of preventing COVID-19 is to wash your hands frequently with soap and water. We remind persons, please, to keep the social distancing a minimum of 6 feet away from persons, and of course, to wear your mask over your nose and your mouth. Thank you very much.
Thank you very much, Dr. Hoyt, for that reminder as we go into what is one of the long weekends every year, the Easter weekend. Thank you very much. And now we go to Dr. Mitchell, and her presentation is twofold. She herself has received the COVID-19 vaccine, and she can give us her experience, but also as an expert, she can provide information on vaccination in general. We go to Dr. Mitchell. And for some reason, we can't hear Dr. Mitchell at this time. I think we may need to just check some of her settings. Let's try Dr. Mitchell one more time.
Good morning, everyone.
Good morning. Thank you, Dr. Mitchell.
Good morning, Ms. Alcantara, Dr. Richards, Dr. Hines, Dr. Hoyt, and the viewing and listening public of Trinidad and Tobago. As Ms. Alcantara said, I would have received the Oxford AstraZeneca vaccine when it was presented to Tobago in February. We would have distributed the vaccine to 114 healthcare workers during that period. I would have received the vaccine in the first batch of persons. In terms of side effects, I would have had fatigue for about 2 days, but I was able to function otherwise. I had tenderness at the injection site. There was no fever. I did have a slight pain behind the eyes on day 3 to day 4, but I usually suffer with migraines, and it may just simply have been as a result of that. Nonetheless, I was fine otherwise. No fever, like I said. I had none of the other common side effects, and I will go into side effects in a short while. I would just like to inform the public that these responses to the vaccine means that the body's immune response is taking place. The body's mounting a response both on the cellular level and on the humoral level in terms of the formation of antibodies to fight against the virus and components of the virus. The Oxford AstraZeneca vaccine introduces a spike protein, which is that attachment on the virus that allows it to stick to your cells and allow the virus to enter into your body. So your body is now going to be able to mount a response every time it sees the spike protein flowing around your system. So the responses that most persons would have, in fact, all persons would have experienced, and it would be from mild to, I wouldn't say severe, but I would say noticeable, would be the body actually mounting an immune response. If you consider children, because we vaccinate a number of children within primary care, whenever they receive the vaccines for the first time, you would notice that the area tends to be tender, sometimes angry in terms of being red. It's painful, and children tend to be a bit on the peevish side. Again, these are all natural responses to the body reacting to the introduction of the antigen. In this case, it will be the COVID-19 spike protein. With regard to side effects and adverse effects, a side effect is an effect that is secondary to the original intent. So that some of the side effects may be known, and this is why we have the trials. You expect things like fever, you expect tenderness at the injection site. Some of the side effects may be unknown. A number of them may be intended as well as unintended. It is therapeutic, but in some cases, you can have adverse side effects, and these are rare events in terms of vaccines. This is why they go through the trial process before they are actually introduced into the general public. Adverse effects are undesirable, and we have not seen, at least in Tobago, any adverse effects to the virus,
And it seems we have some connectivity issues with Dr. Mitchell. It's very unfortunate because the information that she's providing is so critical. And we will attempt to reconnect with Dr. Mitchell now, and hopefully we have fixed the technical issue. And we haven't, unfortunately. So what we will do is go straight ahead into the question and answer segment. And if we are able to reconnect with Dr. Mitchell, we will definitely allow her to complete her presentation because the information is that critical. And I think now Dr. Mitchell is back on, yes? Okay, let's try one more time to continue the presentation from Dr. Mitchell, please.
All right. I'm sorry about that. How far?
Thank you.
All right. So just in terms of the side effect and an adverse effect, I'll just repeat that. A side effect, the secondary effect.
Okay, unfortunately, I think we will have to address that matter a little later on, and we will go into the question and answer segment at this time. Members of the media are asked to begin by stating your name and the name of the media house that you represent before you put forward your 2 questions to our panelists, please. No more than 2. Please ask both at the same time, and we hope that your questions can be brief so we can respond to as many as possible. We begin this morning with 2 brief questions from CNC3 of Guardian Media Limited.
Hi, good morning, everyone. Rashad Khan, Guardian Media here. My first question is to Dr. Hoyt. Given the number of people that you all anticipate to come over to Tobago for the Easter weekend, is your unit doing anything to prepare for any sort of spike, or are you all anticipating any sort of spike? And my second question is, given that Jamaica would have received its vaccines from COVAX earlier this week, do we have any more confirmation, or do we have any confirmation at all as to when we will be getting our doses? Thank you.
Thank you very much. And we go to Dr. Hoyt for a response to the first question, please.
Hi, thank you for that question. So yes, we have started, like I said, we collaborate closely with our tourism stakeholders as well as our stakeholders in the TTPS, etc. So we are doing sensitization to our hoteliers, and we also doing sensitization to our reef tour operators, because we recognize that persons have started to try and resume full occupancy, which is not supposed to be the case. We want to remind persons that, yes, the reef tours are allowed to continue, but not at maximal occupancy, because we want to have the physical distancing between persons. So for all our tourism stakeholders, whether it be the hoteliers, the tour operators, etc., we are having discussions with them. Of course, our TTPS is our enforcement arm, and they, of course, will also be in discussions and be prepared. And I would like to take the opportunity to remind persons, because remember, everyone also has personal responsibility in this fight, that we have been preaching the 3 W's: wear your mask properly over your nose and mouth, wash your hands frequently, especially when you go into establishments. Most establishments have hand washing stations. If they don't, they definitely have hand sanitizers inside. So please ensure to practice the public health protocols and, of course, physical distancing. And persons are reminded that on the beach, although you're not using your mask in the water, while you're on the sand, you're supposed to be wearing your mask. Thank you.
Thank you very much. And we go to Dr. Hines.
Okay, now before I address the second question, I just wanted to tack one bit on to the risk reduction where traveling to Tobago, etc. is concerned. And it goes without saying, but sometimes you still need to say it, please do not travel if you have symptoms of respiratory illness. If you are ill, you may want to postpone the time frame within which you travel. Do not travel while ill. Do not travel while feeling stuffy, feverish, having respiratory symptoms of any sort. Although we know it goes without saying, we still need to make sure that we re-emphasize that very important public health precaution. Now, with respect to the second question, very brief answer. The already established schedule for receipt of vaccines remains unchanged, which means that we're still expecting our vaccines around the end of the month. Thank you.
Thank you very much. And we go now to AZP News, please.
Hi, good morning. Priya Bihari, azpnews.com. My first question, Dr. Hines, when the CMO was here on Monday, he said that the clusters in Caroni came from employment where people worked and where they gathered. Can we say exactly what sort of jobs that these people do, that is causing this spread, and also where these people gathered? Is it churches? Is it bars, etc.? Have we found out exactly where they were contracted? And my second question to Dr. Hoyt. Dr. Hoyt, good morning. The 159 cases you said 30% of them showed no symptoms. So do you have an idea how they contracted it, and at what point in time, they were tested, they came into tested after they got the symptoms then, in other words? How did that work? Thank you.
Okay, thank you, Mr. B. Harry. Now, the issue of the details with respect to the Caroni cases, we're actually going to explore in a little more detail on Saturday when we have the CMOH back with us. But the usual suspects with respect to gathering places are basically in play, as they always are. And this is why we continue to ask the population to adhere to the regulations that prohibit some behaviors and prohibit gathering in certain places. We will address that in additional detail when we actually bring Dr. St. Bernard back to expand on that cluster, as it is really a good example of how small changes in behavior in a small number of people can have a big impact on the epidemiology of the virus in the population. Just to tag on to this first part of the second question, before we go to Dr. Hoyt, again, just to remind you that whether someone is symptomatic or not symptomatic has nothing to do with where they would have gotten infected, and it also does not give you an indication of where a person may have become infected. Quite frequently, when people get infected, symptomatic or not, they are unaware of the individual to whom they may have been exposed. So just to ensure that that bit of the science is clear while we move over to Dr. Hoyt for the more detailed answer.
Thank you. We go to Dr. Hoyt.
So thank you for that question. So as my colleague, Dr. Hyde, so expound further on what Dr. Hines would have shared, with respect to the persons who were asymptomatic, just recall that persons can be infected with COVID-19, not have any symptoms. A lot of people just have very mild symptoms and still spread it. So the persons who we would have detected who had no symptoms, most of them we would have picked them up because they would have been either primary or secondary contacts of confirmed cases. And in doing the contact tracing, once someone is identified as a close contact of a confirmed case, we test them as well as quarantine them. So in doing the testing of the contacts, we would have picked up those who didn't have symptoms. What we found is a lot of our contacts were not social in terms of persons socializing outside the home. A lot of our contacts were family members as well as work contacts, because there was a period in time where we would have made a plea to persons to remember, if you are ill, please do not go to work, because we would have had cases where persons know they're ill and they choose to go to work ill, and then they spread it to their co-workers. So a lot of our contacts were predominantly close contacts through either being in the same household or being co-workers. Thank you.
Thank you very much. We go now to Wired 868, please. We go to Wired 868 for their questions.
Hi, good morning. Can you hear me? Okay. Morning, Fayola Bostic, Wired 868. My first question is whether we know where the cases from that Tobago has come from, were they all Trinidadian or other imports, and whether or not Tobago is considered in community spread. And my second question is, are there separate border control protocols in Tobago with respect to especially Trinidadian visitors, because the borders will be closed to everybody else? So do they still have to do the same quarantining period as somebody coming from externally, or is no quarantining period and PCR testing and those things necessary when entering Tobago?
Thank you very much. We go to Dr. Hoyt first, and then we'll come back to, I think, Dr. Richards for some additional info. So we go to Dr. Hoyt, please.
All right. Yeah. So I remember, I know you had multiple parts. So with respect to the borders, that's the one I remember right now. So remember that although Trinidad and Tobago is two separate islands, we are one country, and you have free movement between the air and sea bridge. So if you are referring to border control between the islands, that doesn't exist. And with respect to persons who are repatriating, The repatriation flights actually all land within Piarco Airport, and persons are quarantined as per the national protocol at the quarantine facilities in Trinidad. So persons from Tobago who are repatriates, the policy is that they do 7 days state quarantine. So this would be done at facilities within Trinidad, and then they do 7 days home quarantine. So when they transfer to Tobago, we would take over the monitoring of them during the home quarantine period. Remind me of the first part of your question, please.
Ms. Bostic, just please remind us of the first part of your question.
Sure. The first part was whether or not we know where the infections came from in Tobago, whether they were Trinidadians or is it in community spread? Where are the Tobago cases coming from?
Okay, thank you. All right, so the 4 cases, all persons reside within Tobago. There was no travel history to Trinidad. And just so that emphasizes the fact that community spread is the presence of the COVID-19 virus in the community is very much there, even when there may be no recorded cases reported. Persons cannot become complacent. Right? The virus is still circulating within our community. So these persons had no travel history to Trinidad. The resident in Tobago, like I said, they all were actually asymptomatic. So it actually is a much more detailed investigation involved when persons are asymptomatic. That's why we would have done a wider nest of testing for primary, secondary, and tertiary contacts to try and detect where the source cases may have been. Now, we have some theories we're working at. We've actually done additional testing in these cases to go on to antibody testing to see if persons previously were infected and didn't show symptoms, passed it on to these persons, etc. So the epidemiological investigations are still ongoing with respect to where the initial index case for these cases may have been. Thank you.
Thank you. And I know Dr. Richards was going to add some additional info, and she'll just...
Okay, thank you, Fiola, for your question. I would like to reiterate that the controlled entry of returning nationals at the borders of Trinidad and Tobago really falls under the purview of the Ministry of National Security with collaboration from the Ministry of Health. Your question focused on persons traveling to Tobago, and as Dr. Hoyt indicated, those would be 2 groups of persons. That is, the persons who are returning nationals and who are repatriated through the Piarco International Airport via international flights, and also the persons or domestic travelers between Trinidad and Tobago. For example, those persons who have now occupied or plan to occupy 98% of all villas in Tobago at this at the upcoming Easter weekend. The border control measures in Trinidad and Tobago would really entail looking at mitigating or reducing the risk of persons coming in with COVID-19, and these measures would include the provision of a PCR test that is negative and according to the correct type of test, meaning the PCR test, within a 72-hour time frame, and of course the state and state supervised quarantine arrangement with 7 days of state or 7 days state supervised, 14 in the case of persons who are coming from the UK, as I explained earlier. Regarding the travel of persons from Trinidad to Tobago, we do work very closely with CAL as well as the Port Authority of Trinidad and Tobago in ensuring that all COVID-19 mitigation measures are in place. That is in terms of sanitization protocols, contact tracing, constant communication and feedback, as well as looking at the occupancy levels of the vessels that are moving persons back and forth or the Caribbean Airlines flights. I have to say that CAL and the Port Authority has been extremely helpful and worked alongside the Ministry of Health and Ministry of National Security teams. And if there are any queries, they contact us immediately so that it is resolved. So, Fayola, I hope this response has answered your question and given you some assurance with respect to measures that are being taken to reduce COVID transmission for persons traveling between Trinidad and Tobago. Thank you.
Thank you very much. And we are very fortunate that now, as I indicated before, we can go back to the rest of the presentation from Dr. Mitchell. And when we come back, I do recognize that we have questions from TV6 and Express. So we go to Dr. Mitchell and then we will come back to the rest of the Q&A.
Good morning again, everyone.
Good morning.
All right, so I'll just pick up where I left off. With side effects, as I said, they are basically secondary to the original intent. The original intent, of course, is to build the body's immune system. However, we do have side effects, but these are therapeutic, and in a number of cases, they can be adverse. The majority of the time, side effects are known and they're intended. However, every so often we have side effects that may be unknown or may be unintended, and the unintended tend to be the ones we deem adverse effects. Adverse effects are undesirable, harmful effects resulting from either, in this case, a medication or vaccine or any other type of medical intervention. It is for this reason that we have associated with the administration of the Oxford-AstraZeneca vaccine an observation time of about 15 to 30 minutes. WHO, PAHO, as well as AstraZeneca have allowed 15 minutes. Here we are ensuring that persons are observed for at least 20 to 30 minutes going forward. The public should note that anaphylactic reactions are seen within the first 10 minutes of administration of the vaccine. With regard to the known side effects of AstraZeneca, they are categorized according to the very common side effects, uncommon side effects, and of course, rare side effects. Very common side effects would include tenderness, as I said, at the injection site, pain at the injection site. You may have warmth as well as itching or bruising. There is also fatigue. Some persons may experience chills, headaches, nausea, vomiting. These are seen in about one out of every 10 persons, and they are mild. We did have a number of persons in Tobago experience absolutely no notable side effects from the vaccine. Common side effects would include fever, and a lot of persons who did report fevers had fevers of about 38 degrees Celsius and above. There's also swelling and pain at the injection site. Uncommon side effects would include swelling of the nose, decreased appetite, dizziness. Keep in mind that swelling of the nose are in fact expected for some persons, as it says that the body is actually building its immune system. I was also asked to speak with regard to the readiness of Tobago for the AstraZeneca vaccines that are coming in via the COVAX facility. We tested the delivery mechanism at the Scarborough Health Center, one of the vaccination sites, in both February and early March. We are in the process of testing the delivery mechanisms at both the Canaan Health Center and the Roxborough Health Center. We have a simulation exercise planned for next week, and we will, of course, be doing our walkthroughs early on from the 22nd to the 23rd of March. Contact information with regard to making appointments for the vaccines are ready. They will be distributed via our Corp.com unit in the not too distant future. Persons who wish to make an appointment to receive the vaccine would be able to message via text or via WhatsApp. We would also send out the email address. Persons can email us, as well as we have an online registration form that will be posted on the TRH website and on the Division of Health, Wellness and Family Development's website in the not too distant future. We are preparing to receive anything between 2,000 and 3,000 doses. when Trinidad receives its first tranche at the end of this month, early April. Thank you, ladies and gentlemen.
Thank you very much, Dr. Mitchell, for joining back into the conference. And we continue with the question and answer segment. We go to TV6, please.
Hi, good morning. Renessa Cutting, TV6 News. Could Dr. Hoyt indicate whether the public health regulations set out any restrictions on occupancy levels for hotels and villas and these types of places, considering the very high anticipated occupancy levels that you all are expecting for the Easter? And also, I was wondering if a representative of the ministry could give us some information as to what may have come out of the talks between the Prime Minister, this government, and China on Tuesday. Thank you.
Thank you. We go to Dr. Hoyt for response to the first question. Dr. Hoyt, can you hear us?
Hi, okay,
Yes.
Thank you for the question. So yes, so the public health guidelines, there are specific guidelines with respect to hotels, etc. And we have actually worked closely with the hoteliers in Tobago to ensure that these guidelines are enforced. Not so much with respect to occupancy, but primarily with respect to frequent cleaning of the regulated surfaces, frequent hand washing in terms of persons using the dining area, ensure there's physical distancing of persons, etc. So there are specific guidelines in place for the hotel industry that our hoteliers are well aware of and have been really good with respect to ensuring that these are enforced, to ensure that there's a safety of persons who use their facilities, including making sure that persons wear their mask in all the common shared areas, etc. Thank you.
Thank you. Dr. Hines?
Okay, thank you for the second question. Not being privy myself to the actual discussions that would have taken place, all we can say at this point in time is that we are aware that there were discussions that would have touched both upon COVID management and upon vaccine delivery and acquisition, and that as any additional information on firm agreements arises, that information will be brought to the public from the appropriate quarters. Those quarters being either the level of the Office of the Prime Minister, Office of the Minister of Health, and that information will be brought forward as it becomes available.
Thank you very much, Dr. Hines. We go now to Express newspaper, please.
Good morning, Kim Bojram from the Express. Just one question that maybe Dr. Richards could take. And just to revisit repatriation and the numbers there, we saw a strong call over the weekend from the business community for a sort of restructured and managed, very responsible, partial reopening of the borders soon because of the impact of the entire situation on the economy. So, and also it's been said before that infection rates coming out of the repatriation exercises are actually low, and community spread is what we're looking at. So, I mean, maybe Dr. Richards, your opinion on, and we know it is a national security issue, but maybe your opinion on whether or not a better structure could be in place now to manage nationals still looking to come in. People are still saying they can't get in, and also from the business aspect, how the borders could be managed. Thanks.
Thank you, Kim. A very topical question that has been discussed at all levels. Again, I'd like to remind everyone that the approval to enter Trinidad and Tobago or leave, that is the exemption process, falls under the purview of the Ministry of National Security. The decisions regarding the borders and restrictions in terms of traveling, the controlled entry of returning nationals and other persons that are deemed essential staff, really falls under the government's policy. And as such, that sort of discussion would have to be taken up at a higher level in terms of the cabinet and so on. What I would like to reiterate is that thus far, the government has been guided by science. And at this point in time, we continue to really focus on our gains and continue along that process without really having a shift or change in the actual policy. Again, that's a much more high-level decision than what we would take at the Ministry of Health. The infection rates amongst the repatriates, yes, we have had evidence of lower than normal rates, but then of course we are looking at that increased measure of COVID-19 mitigation, which would be the RT-PCR test done within a 72-hour window. However, there is the risk of introduction of a new variant, which really is what we are also looking at in terms of the controlled process. So in summary, the decision to really to have some sort of variation or deviation in the border control process would really fall under the ministries, or the Ministry of Health, National Security, and the Prime Minister. And so it's a high-level policy decision, but we continue to ensure the safe return of nationals through this process from a national security and health perspective. Thanks.
Thank you very much, Dr. Richards. We go to TTT, please.
Yes, hi, Sonal Lala, TTT News. To Dr. Abdul Richards, I know you mentioned that the repatriation exercise has been successful so far, and that no persons have been turned away. What would give a person chance not to actually be turned away? What are some of the reasons? Can you tell us? And to Dr. Hoyt, just some clarification. Just when's the last time Tobago actually recorded a case? How much days has the island actually been without active cases or any new cases of COVID-19?
Thanks, Sunil. The only consideration that we would look at, and this is as per the Ministry of Health, National Security, and overall government policy, to have a person not board a flight would be if they do not have a negative PCR test done within the 72-hour time frame. That is clearly indicated when they receive their approval for exemption to enter into Trinidad and Tobago. And so at the port that they are leaving from, which really we look at places like JFK, Toronto, Miami, Bridgetown, and in some cases we might do a Kingston or Georgetown or out of Grenada, the persons must present to the agent, to the CAL agent, and if it's a private charter, they must send or have submission of a negative RT-PCR test. That is really to reduce their risk. Now, if someone comes with an antigen test or an antibody test, or the test is outdated, we cannot allow them to really board that flight, because what we would be doing by then is increasing the risk of someone with an unknown status or who's of higher risk of actually having COVID board a flight with several persons on it, with sometimes close to 100 or more persons. Additionally, if at the gate or at the check-in desk somebody is noted to have symptoms in spite of having a COVID-19 test that is negative on RT-PCR tests, there will be some discussion with the Ministry of Health, and that person will not be allowed to board the flight. COVID-19 is actually a new virus. It's evolving. The symptomatology is not as clear as we would like it to be just yet, having been around, for just over one and a half years now. And so we operate out of an abundance of caution to ensure that all our returning nationals and persons who have to enter Trinidad and Tobago to work in the essential services are safe upon entry. And again, we would like to thank all persons who are repatriated as well as their families for exercising patience and for following the Ministry of Health and National Security's policies. Thank you.
Thank you very much. We go to Dr. Hoyt, please. Dr. Hoyt, I don't think we're hearing you. Not sure if your mic is muted.
Okay, am I unmuted now?
We can hear you. Thank you.
Okay. So our last reported case would have been on the 3rd of March. So as of 10 p.m. yesterday, that would have made it 13 days that we've had no recorded cases. So thus far, 13 days.
Thank you very much. And we go to AZP News now for a follow-up question, please.
Hi, good morning. Prior again, AZP News. I just wanted to follow up on Kim's question to Dr. Abdul Richards. Dr. Abdul Richards, since we have a 2% occupancy rate now, is it now a good time for the ministry, therefore, to recommend that we increase the number of people who may come into the country, who may be repatriated at this point in time? Thank you.
Thanks, Prior. The Ministry of Health really would be responsible for managing the health sector's response to COVID-19. And yes, we have seen declining hospital occupancy statistics, but we would continue to provide that information to the cabinet and to the ministry, the ministers who are the policymakers in taking that decision forward. Thank you.
Just to add, maybe for the sake of clarity, the 2% occupancy is the occupancy of the hospital system, which is different from the occupancy of the quarantine system through which returning nationals are being put. So I'm not sure if Mr. Bihari is conflating the 2% occupancy in the hospitals with the occupancy in the quarantine sites that accommodate the returning nationals.
Thank you very much. And we go now to Wired 868 for a follow-up question, please.
Hi, just one more question concerning Tobago. I was wondering, since Tobago, with its 159 total cases as compared to the 7,800 cases we've seen as a country, they really account for such a little portion of our cases. I'm wondering whether or not the policies that we have in health measures and the health ordinances, whether or not they should be different for the countries to reflect the different situations that we have in both islands. It's because Tobago is tourist dependent, so I'm just wondering if they maintain 0 new cases for a while, whether that could help reduce some of their restrictions, so that so that the economy can really rise again, or if there's any good to having separate policies for the islands is my question.
Thank you very much, and I think Dr. Hoyt understood your question clearly, so we'll go to Dr. Hoyt.
Thank you for that question, and I would indicate that has been a topic of much discussion throughout this outbreak. And what we highlight to persons is a couple things. Trinidad and Tobago, separate islands, but one country with free flow between our air bridge and sea bridge. There's no restrictions between the movement of persons between islands. And just as similarly as we would see in Trinidad, there are certain counties that currently have no cases, but there's free movement of persons throughout the island. And it's basically the same principle. Whatever is going on, it actually affects everyone because everyone is able to move around. So even if there are no recorded cases here, if there are a number of cases being recorded in Trinidad, because persons can move freely, it means that we still have to stick to the public health policies and the COVID-19 protocols to protect everyone, to protect all the citizenry. Because with the free movement, it really doesn't mean that it's a different context that we're operating in. Thank you.
Thank you, everyone. We have come to the end of today's media conference, and we're grateful for everyone who's joined, especially our colleagues in Tobago, Dr. Mitchell and Dr. Hoyt. And before we go to a brief video on variants, and just reminding everyone, you've heard us say this throughout the conference, the 3 W's: wash your hands, watch your distance, and of course, wear your mask.
Seen different viruses variations. That's what a variant actually means, where the virus has a small variation in its genetic code. It doesn't necessarily mean that the virus behaves any differently. You see that amongst humans all the time. We have slight